If you're over 60, your annual checkup is missing something critical, and it could cost you your independence or worse. Last year, a 67-year-old woman I know went for her annual physical checkup. Her doctor said everything looked great. 6 months later, she fell suddenly and her hip got broke. Turns out there was a simple 30-second test that could have predicted and prevented that fall, but her doctor never did it. Here's the truth. Most doctors are overworked and follow a standard checklist. But there are 5 critical tests that slip through the cracks, tests that can catch problems before they become life-threatening. Today, I'm revealing all 5, and the best part? You can request them yourself or even do some at home. Let's start with the one that could prevent your next fall. Test number 5, Grip Strength Test, your life predictor. This sounds strange, but grip strength is one of the most accurate predictors of your overall health and longevity. Studies show that weak grip strength is linked to higher risk of heart disease, earlier death, faster cognitive decline, loss of independence. This test is being done by squeezing your hand with a device called a dynamometer. The benchmark for men over 60 is they should grip at least 27 kg, 60 pounds. For women over 60 is they should grip at least 16 kg, 35 pounds. Anything significantly lower means your overall muscle mass is declining dangerously. Why it matters? Weak muscles mean you can't catch yourself when you fall, can't open jars, can't lift groceries. Your independence disappears slowly, then all at once. Now what to do? Ask for a grip strength test. If it's low, start resistance training immediately. It's never too late. Test number 4, the vitamin D blood test. Here's a shocking statistic. Over 40% of people over 60 are vitamin D deficient, and most have no idea. Low vitamin D causes weak bones and fractures, depression and mood changes, weakened immune system, increased risk of dementia. This test can be done with a simple blood test measuring your 25-hydroxyvitamin D level. The benchmark for this test is your optimal range should be 40 to 60 ng or ml. If it's below 30, you're deficient. If it's below 20, you're severely deficient. Most doctors don't test this routinely because it's not always covered by insurance. But it costs around $50 to $80 out of pocket and could prevent thousands in fracture treatments. What to do? Request a vitamin D test at your next appointment. If you're low, supplement with D3, not D12, and get 15 minutes of sunlight daily. Test number 3, thyroid panel, TSH, T3, T4. Your thyroid controls your metabolism, energy, mood, and weight. After 60, thyroid problems become incredibly common, especially in women. Symptoms of thyroid problems: unexplained weight gain or loss, constant fatigue, depression, memory problems, feeling cold all the time. Here's the problem: these symptoms are often dismissed as just getting older. But they're not. They're fixable. This test can be done with a simple blood test measuring TSH, free T3, and free T4. The benchmark for this test is the optimal TSH range should be 0.4 to 4 MIU or L. Though some experts say 0.4 to 2.5 is optimal, many people feel terrible with a TSH of 3.5, even though it's technically normal. What to do? Request a full thyroid panel, not just TSH. If you have symptoms but normal results, consider seeing concerned doctor. Test number 2, cognitive function screening. Here's something most people don't think about. You need a baseline measure of your cognitive function before problems start. Why? Because if you start having memory issues at 70, how do you know if it's normal aging or early dementia? You can't, unless you have a baseline from when you were 60. You can do Mini Mental State Exam, MMSE test, and Montreal Cognitive Assessment, MOCA test. These take 10 to 15 minutes total. What they measure: memory, attention, language, problem solving. Getting tested now gives you and your doctor something to compare against later. Early detection of cognitive decline means earlier intervention. What to do? Request a cognitive screening at 60, then every 2 to 3 years. If there's a family history of dementia, do it annually. Test number 1, DEXA scan for bone density. Women know about this test, but most men ignore it. Big mistake. 1 in 3 women and 1 in 5 men over 50 will break a bone due to osteoporosis. A hip fracture after 65 has a 20% mortality rate within a year. The test name is DEXA scan dual energy X-ray absorptiometry, when you should get it, for women. Age 65 or earlier if you have risk factors. For men, age 70 or earlier with risk factors such as family history, smoking, low body weight, steroid use, excessive alcohol. The scan is quick, painless, and tells you exactly how strong your bones are. What to do: if you haven't had one, schedule it. If you have osteopenia or osteoporosis, there are medications and lifestyle changes that can rebuild bone. So now, here's what I want you to do. Don't wait for your doctor to suggest these. Print this list, take it to your next appointment. Ask for each test that's appropriate for you. Your doctor isn't hiding these from you on purpose, they're just busy and following standard protocols, but you have the power to advocate for your own health. Remember, the goal isn't just to live longer. It's to live strong, independent, and sharp for as many years as possible. Which of these tests have you never had? Let me know in the comments. And if this video helped you, please share it with someone over 60 who needs to see it. Your future self will thank you.